Hello everyone, welcome back to the channel. If you are an MBBS student preparing for forensic medicine, today's video is must watch. We will cover the medical certificate of cause of death MCCD, the most important and most commonly asked university and Viva questions, along with the few important NMC and Bharatiya Nyaya Sanhita concepts. So let's get started. In this video, I will discuss the most important Viva questions only for your knowledge. Generally, the medical certificate or legal mandates are asked in the format of the OSP, your exam. So you have to duly filled a MCCD certificate in your hand, and then when your professor will ask this for the cross examination, you have to answer this Viva questions, and you will need to know this MCCD certificate Viva points. So I will discuss here only the Viva points only. Next video I will discuss how to fill the MCCD certificate and all. So let's get started. What is the full form of MCCD and what is the primary statutory purposes within the National Health Framework? MCCD stands for Medical Certificate of Cause of Death. It is a standardized certificate recommended by the World Health Organization and used in India to record the medical cause of death accurately. These records help the government understand disease patterns and plan public health policies. Next questions. Who is legally authorized and responsible to issue the MCCD, and under what specific clinical circumstances must a practitioner strictly withhold it? Withhold it means suspend it or and not issuing this MCCD certificate. So only the registered medical practitioner, RMP, or the doctor who treated the patient during the final illness can issue this certificate. But remember one important rule: the doctor should be confident that death is due to the natural causes. If the person is brought dead or there is the suspicion of the suicide, homicide, poisoning, accident, or any unnatural death, the doctor must not issue an MCCD. Instead, the case should be treated as a medical legal case (MLC) and report to the police. Most important. So, one question asked, how many copies of the MCCD are legally required to be prepared, and how is each copy routed through the institution and public record system? So the certificate follows a counterfall system. You should know that one copy remains with the hospital or the doctor for legal records, and second copy is given to the relatives or forwarded to the local register of the births and deaths. So where must the completed MCCD form be sent following a patient expiration, and what is the statutory timeline for its submission? So after issuing the certificate, it is to be sent register of birth and death, as such as municipal corporation, municipality, or the Gram Panchayat office. This helps the official registration of deaths, after which the family receives the official death certificate. So how is the internal structural hierarchy of the MCCD form divided, and which specific columns or the lines must be completed to establish the timeline and underlying clinical triggers of mortality? So here are the questions asked about the structure of the MCCD. You should know the structure of the MCCD. Now I will discuss it. The MCCD is divided in part 1 and part 2, two parts. So part 1 is the chain of the events leading to the death. This section explains exactly how the patient died. So line A, it is the immediate cause of death. It is the final disease or complications directly responsible for death. A common mistake is writing cardiorespiratory arrest. I have seen some of my batchmates So remember, cardiorespiratory arrest is only the mechanism of the death, not the actual cause. Always mention that this is responsible. Next, here comes the line B and the line C. It is the antecedent causes. These are the diseases or the conditions that lead to the immediate cause. Lowest completed line, usually line C or line D. Sometimes line D are absent. Underlying cause of the death. It is the disease or injury that started the entire sequence leading to the death. It is considered the most important part of the MCCD because national mortality statistics are based mainly on the underlying causes. Next, here comes to the part 2. Part 2 includes other significant medical conditions that contribute to the disease but were not directly part of the main sequence. For example, a patient may die from the pneumonia but also have diabetes and hypertension. These conditions, that is for diabetes and hypertension, are treated in the part 2 if they contributed to the outcome. Before that, I include some important column, that is time interval column. We often confuse with the time interval column. Another important section for each condition mentioned, the doctor should estimate how long the patient had that condition before the death, whether hours, days, months or years. And another part is the pregnancy related death. If the deceased woman belongs to the reproductive age group, means she is pregnant or have the pregnancy or not pregnancy. Also 15 to 45 years is the reproductive age group in our data. So if the woman is from 15 to 45 years, then additional information should be recorded regarding whether the death was associated with pregnancy or childbirth. So here I have to discuss about the ethics, some NMC ethics. What is the exact penalty mandates under the National Medical Commission NMC regulations for medical professions found guilty or of issuing a fake certificate? So now let's discuss a very important medical legal point. What happens if the doctor issues a fake medical certificate? Another NMC regulations issuing the false certificate is considered as professional misconduct. The punishment may include the suspension or even permanent removal of the doctor's name from the medical register. Permanent removal is often referred to as the professional death because the doctor legally loses the right to the practice medicine. So always remember that never issue any certificate without proper examination and genuine clinical evidence. So here are some important medical sections of the legal sections. So what the legal definition and medical legal applications of sections 102 of the Bharatiya Nyaya Sanhita BNS 2023 regarding culpable homicide? So culpable homicide by causing death of the person other than the person whose death was intended. Okay, the equivalent to the doctrine of the transfer of malice or old IPC section 301. So here it deals with the causing the death of the person other than the intended victim, commonly explained using the principles of the transferred intention. So about BNS section 103, what statutory provisions and punitive measures are established under the section 103 of the Bharatiya Nyaya Sanhita 2023? Punishment for murder. It detects. This section indicates the punishment for murder. It dictates that whoever commits murder shall be punishable with death or imprisonment for life, and shall also be liable for a fine equivalent to the old IPC section 302. How the section 233 of the Bharatiya Nyaya Sanhita 2023 penalizes the corrupt use of the fabrications of the medical records, certificates or MCCD as a legal evidence. Using the evidence known to be false. This dictates that everyone who corruptly uses or attempts to use a document like a fake medical certificate or falsified MCCD as a true evidence, knowing it is fabricated, will be punished exactly if they gave the false evidence, equivalent to the old IPC section 196. Before that questions, I have to add one more section, that is section 171B, that is the relevant act equivalent. The section 171B, that is typically deals with the public justice or the electoral offences or the public compliances depending on the specific schedule, but in the forensic context it links back to the state mandate notification structure. So that is the most important question. Why are the sub-clauses, that is line 1C and line 1D, clinically designed as the essence of the MCCD form, and how do they alter the public health epidemiology data? The primary clinical purpose of the MCCD is to extract the underlying cause of the death for the national health statistics. So line 1A, it is the immediate cause, the final condition directly causing the death. Line 1B and line 1C, it is the antecedent causes. That is the chains of the events leading to the immediate causes. The lowest used the lines, that is part 1, 1C and 1D, the underlying cause of the death. It represents the disease or injury that initiates the train of morbid events leading to the directly to the death. It is the essence because the public health policies and preventive medicines data are calculated strictly based on the underlying triggers rather than the terminal mechanisms like cardiac arrest. Here, in case of the cardiac arrest, the line 1, the immediate cause is the cardiac arrest, but the underlying cause, that is 1C and 1D, will be the hypertension or diabetes mellitus, because this leads to the cardiac arrest. Okay, so what is the important for the epidemiological data? Epidemiological hypertension is the main epidemiological data we need. The hypertension is a non-communicable disease, so here the line 1C and the line 1D is clinically designed as the essence of the MCCD form. So if you found this video helpful, don't forget to like this video, subscribe to the channel and share it with your classmates. If you have any doubts, leave them in the comments and I will answer them in the next video. Thank you for watching and I will see you